Egg freezing offers women a chance to preserve their fertility, and this is not only offered to women who want to preserve their fertility for medicinal reasons such as undergoing some form of cancer therapy, but also offers women the option to preserve the fertility for social reasons. So egg freezing has evolved as a technology in this last 10 years because of the optimized success rates. Egg freezing has been performed in the UK since 1990s. However, the technique has evolved a lot since then to the present times. And the main developments in this arena have been in the laboratory. The reason for that is the revised or the optimized technology of vitrification, which is now being applied to freezing of eggs. Traditionally, in the olden days, the methodology revolved around slow freezing of human eggs. With the new technology, which enables further dehydration of the egg, leading to less water retention in the egg, which then means that there is less intracellular ice crystals, which lead to the damage of the egg per se. So all in all, further dehydration, faster freezing enables the technique of vitrification, which enables better survival. The success rates have changed in many ways. The survival rate of the eggs is much better with vitrification. We attain in excess of 80 to 85% survival rates of the eggs. In the olden days, we used to get around 50% survival rates. Survival rate is one aspect or a measure that looks at success. However, the bigger measure is the chance of having a baby. And in the olden days, again, with slow freezing as a technology, the pregnancy rate per egg was very minimal. Nowadays, we're quoting a pregnancy rate of around 60% in women under the age of 35, should they have at least 8 to 10 eggs frozen. Technology has evolved a lot in this last 10 years in itself. So I know for a fact that scientists who have developed vitrification as a tool are working towards optimizing the technology further. We are pretty much at the pinnacle of success rate when it comes to cryobiology or freezing technology. So we may get better by a few percent, which will be great. It would be amazing to take survival rates of eggs to around 90 to 95%. And I think certainly that in this next 5 years, we may see this increment in success rates. I think the future of IVF revolves around optimum freezing technology. And the fact that nowadays we're almost performing over half the number of IVF cycles that we do with the aid of egg or embryo freezing suggests that this technology works very well when applied to patients. A lot of patients, when they're having controlled ovarian hyperstimulation to make them produce quite a few eggs, which is part and parcel of IVF, they prefer to break the cycle by freezing their eggs and then coming back for an embryo transfer at a later date. This gives their body an ability to recover from all the hormonal stimulation, and at the same time they are more relaxed because the whole process can be broken down into two parts. Being embryologists, which is a very new and dynamic profession, and to be honest, embryology as a profession has attained quite a lot of recognition in this last 10 years. We used to be considered the scientists behind the scenes who are pretty much in the dark performing the embryology, and nowadays it's attained a lot of patient liaison, patient contact, etc. So to me, embryology is very fascinating, it is very exciting, and to a certain degree it gives me a lot of job satisfaction because I know that I can try and make a change in someone's lives. When couples come to an IVF clinic, they expect a lot of sympathy, they expect a lot of professionalism, and working with patients, together with patients, to give them optimized care, whether it leads to success or not, is a very fulfilling part of my role. I trained at CRGH. I have been at CRGH for 17 years now, so it's been a long time, and I have seen the unit grow leaps and bounds. We used to perform 170 cycles in 1998, and we're touching almost 1,500 to 1,600 cycles a year now. So CRGH has grown a lot, and we have grown with CRGH. Ideally, the chances of pregnancy in any woman is based on two factors. One is her age and the other one is her ovarian reserve. This is classically the test that they perform clinically to assess a patient's potential to produce eggs when given stimulation. During the process of stimulation, the drugs that are given to her makes the woman's ovaries produce more and more eggs. So in terms of the success rates are determined on if the patient is young, A, and B, if she has a good ovarian reserve. If the patient is older, obviously the quality of the eggs can be questioned because of the chromosomal abnormalities within the eggs. So it's not so much the survival of the eggs that is questioned during egg freezing, but it's more the potential of the eggs after they've been defrosted. We cannot change the makeup of the egg, we can only preserve it. So the chances of any woman conceiving is based on the predisposing factors, which is her age and her ovarian reserve.